Hi, my name is Eugen Lett of Georgia Military College in the course of BSM 492 Capstone Healthcare Management. This presentation will be reviewing the study of the causes and solutions of nurse turnover and nursing shortage in America. The nature of this presentation is to discuss past nursing shortages and how they were overcome, as well as how organizational cultures such as leadership styles, workloads, and staffing shortages have affected burnout, job satisfaction, and nurse retention and turnover. To begin, the shortage of nurses has been a long-standing issue in modern medicine that can be seen as far back as the late 20th century. During these shortages, nurse retention was low and turnover was high, so leaders in the healthcare industry and nurse leadership positions were forced to review the common factors causing these shortages and what may be done to resolve these issues. Many studies supported that nurse retention and recruitment may benefit from improved training programs, review of leadership roles and styles, and the relief of heavy workloads of nurses. The results of this study highlight the major difficulties in keeping and attracting nurses, which also have significant financial consequences for hospitals, in addition to job contentment and staff retention amongst nurses. In more recent years, especially since the COVID-19 pandemic, the shortage of nurses has become even more prevalent. While nurses enjoy the meaning of their work, like helping and aiding patients, they have also expressed lacking their own motivations within the workplace. Organizational culture, fair compensation, work flexibility, and staffing all play very important roles in nurse satisfaction and the quality of care to the patients. In addition, newer and younger nurses are starting to leave their jobs faster, like within their first year, as older nurses that are closer to retirement are growing more exhausted by the demands and expectations of training these new nurses, which are prompting them to leave their jobs at a significantly increasing rate. The objective of this research is to examine the reasons why nurses are leaving their positions and to assess the effectiveness of retention initiatives in hospitals. The research will be addressing the following research questions. 1, what has contributed to nurse turnover in the past? More specifically, the late 1990s into the 2000s and how hospitals have reacted to these nursing shortages. We'll also be looking at how heavily organizational culture impacts nurse satisfaction and thereby nurse retention. This will include leadership styles, issues pertaining to workload and overtime practices and burnout. Lastly, we'll be looking at what healthcare management and leaders have done presently to increase potential nurse retention. In the past, nursing shortages have typically been due to the imbalance between the demands of the market and satisfying wage levels. However, in the early 20th century, the problem became balancing the lack of nurses coming into the profession with the retiring nurses leaving the profession. We can start by looking at the nursing shortages that happened in the 1990s. During this time, there was a growth of managed care created by healthcare cost pressure, making wage and employment growth slower than in areas with lower managed care enrollment. As a result, workloads increased as wages went flat. Due to these cost pressures in the 90s, hospitals reduced staffing and implemented mandatory overtime policies that significantly increased workloads for registered nurses. Nearly half of surveyed hospital nurses were found to be dissatisfied at their jobs and had high levels of burnout, and only about 1/3 of the respondents of a Pennsylvania study thought that there were enough nurses to provide quality care and to work efficiently. Now, going into the early 2000s nursing shortage, there were about 2.2 million registered nurses in the U.S., and 1/3 of those nurses were eligible for retirement in the next 10 to 15 years. The problem now was that there was a shortage due to limited growth in new entrances into the profession, which is evident by the total graduates from nursing programs between 1995 and 2000 falling by 26%, and there was only a 3.7% increase in nursing school enrollment in 2000 to 2001. Now, this can be due to a combination of an aging working population combined with the increase of career options that were open and available to women born after the 1950s, which resulted in fewer women choosing to enter the nursing field at all. An issue brief by Keenan and others in 2003 supported this by citing that women born in 1970 were 35% less likely to enter nursing compared to women born in 1950, and women born in 1975 were 40% less likely. Also, the cost pressures that occurred in the 90s also may have affected the decision of many potential nurses to enter into the nursing profession because they also suffered from an increased workload. That, as well as low and unsatisfactory wages combined with mandatory overtime policies, led many to feel that they were not getting paid their full worth, and basically that the work was not worth the stress, which made nurse recruitment even more difficult than it already was. Federal and state policies also sought to improve recruitment and retention success through various policies. For example, work environment improvement involved creating policies that rebuild nurse leadership roles and reorganizing nursing workloads by reducing paperwork so that registered nurses would have more patient care focused time. By redesigning the staffing and overtime policies in hospitals and reducing nurse workload, these policies were created in hopes to result in higher job satisfaction among registered nurses and to better patient care. The Department of Defense and Veterans Health Association also implemented initiatives to increase recruitment rates. This included adjusting entrance requirements, providing federally financed educational opportunities, specialty bonuses, and others with the aim of recruiting and retaining adequate numbers of nurses to participate in disaster preparedness and response, as well as intensive care services. Previously mentioned, the need for a college degree kept many potential nurse applicants out of the selection pool, as seen in the 2000s poll of graduates with diplomas versus bachelor's degrees to the right. As you can see, although the proportions of diploma, associates, and bachelor graduates stay relatively similar to each other from the years 1985 or older to 2000, the most recent number of graduates with college or university degrees has dropped compared to the numbers from 1985 to 1994. This graph shows how the restrictions on acceptance to secondary education has limited the potential number of nursing applicants, leading to the current shortage of eligible nurses. It's also important to note that the dedicated training hours and the need for experienced educators for new graduates means higher turnover costs, with research showing that new hires recruitment and onboarding processes equal 1.5 times the annual compensation of an experienced nurse. The organizational culture of a healthcare organization has a significant impact on nurses' retention and intentions to stay with their organization. So it's important for those organizations to place a strong emphasis on prioritizing effective leadership and cultural values. Prior to the COVID-19 pandemic, more than 50% of nurses experienced burnout due to various stressors, which might have included poor leadership, inefficient work processes, long hours, and a lack of control in the workplace. The term burnout doesn't only refer to feelings of extreme exhaustion, but it also has an adverse effect on personal and mental well-being. So it is also associated with high turnover and reduced efficiency in the healthcare setting. Post-pandemic healthcare has placed an importance on self-efficacy and job satisfaction as it relates to nurse retention, and it has been emphasized, resulting in recommendations that healthcare organizations implement effective communication tools and mental health services to enhance nurses' job satisfaction. It's also been emphasized and argued that nurses have the urgent need for prevention and treatment strategies to not only better handle daily hospital activities and inefficiencies, but also, more importantly, the psychological effects of emerging virus outbreaks on healthcare workers. Improvements of nurses' mental health and job satisfaction can have a profound impact on their retention and intentions to stay at their jobs. High nurse turnover negatively affects an organization's potential to fulfill patient needs and provide quality care, which makes it a key factor for the morale and motivation of nurses to stay to provide care while new nurses or new staff members are hired and trained. Presley and Garside conducted a comprehensive review and analysis in 2023 of the various factors that influences nurses' job satisfaction and organizational commitment. This review and analysis ultimately revealed various methods of structural framework within the workplace that could help to satisfy workers while also emphasizing the organization's goals. The issue of nurses leaving their positions or profession altogether presents a challenge for the healthcare industry, in addition to the number of qualified nurses currently working that are slowly and steadily dwindling due to occupational burnout. Istebsky in 2023 and some others used a sample of healthcare workers, half of which had 10 or more years of experience, and surveyed them using a series of questions related to workload, workplace trauma, financial situations, and stress. Occupational burnout was found to be highest in nurses at 18% compared to physicians and other medical professionals. And also, frontline nurses were susceptible to depression at 43%, which institutes a greater need for interventions to prevent or reduce burnout. Nurse managers and leaders also face daily stressors on top of their responsibilities as nurses, especially for those who are responsible for multiple patient care areas. So, therefore, the style of leadership of nurse managers play an essential role in their subordinate nurses' commitment to their jobs and contribute to the cost effectiveness of training and recruitment processes in hospitals. These daily stressors are considered an occupational hazard, but chronic stress combined with workplace burnout can be dangerous and, at the very least, counterproductive to the operations of nurses and other healthcare professionals. For example, in a study by Freth-Cozens and Greenhalgh in 1997, 225 physicians reported 76 incidents where they believe that patient care was negatively affected by their stress, which resulted in some degree of gross negligence on their part. Some other reports similar to those have been made by staff in nursing homes, long-term care, and emergency response facilities. One of the proposed methods of leadership in healthcare is trauma-informed leadership, which has been widely adopted in healthcare practices, specifically nursing practices, but hasn't been readily adopted by their administrations or policy domains, mainly due to their high cost. Trauma and the stress that stems from trauma has played a major part in nurse turnover and their intentions to leave their jobs, especially in post-COVID environments. So identifying these traumas is an important step in nurse leadership because nurses are people too, and they bear emotional scars that may not be visible or noticeable on the outside. This leadership style involves acknowledging that these healthcare workers face many deaths, many losses on a daily basis, and it requires insight, and looking into these traumas on a deeper level will help nurses feel the consequences of what they have experienced and facilitate the healing process so that it will positively affect their quality of work and efficiency. as well as improve retention. Another popular style of leadership in the healthcare environment is transformational leadership, which is characterized by leaders who promote intellectual stimulation, collaborative openness, and attentive listening that can motivate nurses and improve retention rates. Not only can transformational leadership significantly enhance workplace communication and productivity, but it also promotes effective communication between nurse managers and their subordinates, which can effectively balance short-term visions and long-term goals. This fosters a culture of mutual respect between senior and newly hired nurses, which can resolve some of the friction between higher level and lower level workers in stressful healthcare environments. Nurses' workloads and overtime practices have also had a direct impact on burnout, which can be due to either continuous improvement from transformational leadership styles and practices or just long hours where they don't find any sleep. These practices have had a direct impact on the increase of medical errors and higher risk to patient safety. In the past decade or so, there have been limits placed on working hours, not just in health-related professions, but also in other high-risk occupations, such as aviation, trucking, and marine industries. In these industries, overtime practices and extreme workloads can lead to dangerous outcomes for not only the worker or the employee, but also for those who consume their services. Specifically, nurses working long hours have had connections with high levels of fatigue, poor service quality, and lower alertness, which can lead to medical errors and higher patient mortality if they aren't acknowledged and addressed. Whether overtime is used because of inefficient staffing levels or just the lack of proper organizational structure and role delegation, it can lead to the increased patient mortality in hospitals, and it also has a ripple effect on the present and future nurses that plan to enter the workforce. Staffing issues can have a direct impact on nurses' workloads, and respondents from the American College of Emergency Physicians that were questioned on the nursing shortage in emergency departments reported that the shortages resulted in negative impacts in quality patient care and the poor utilization of staff to fill those nursing roles. While the majority of nurses have a moderate level of stress that they face on a day-to-day basis, those who work more than 40 hours a week experience much higher levels of stress. Because they need to be responsive 24/7, their long and irregular hours can directly impact the health and safety of themselves and others. When a person works long and inconsistent hours 7 days a week, and their daily is filled with events that are altogether unpredictable, uncontrollable, and overloading, they can experience emotional and mental and physical stress. Istevsky in 2023 examined the psychological factors associated with work-related stress, particularly after the COVID-19 pandemic. He found that it impacted the risk of burnout, patient dissatisfaction, and the labor force. Additionally, the increased risk of infection and unsecure conditions in the workplace also increased negative mental effects and feelings of anxiety, prolonged stress, and depression. Consequently, after the pandemic, there was an increased turnover of 27.1% compared to the 18.7% turnover rate in 2020 and 15.9% rate in 2019. The question is, what can healthcare management and leaders do specifically to help resolve some of these issues involving high work-related stress and increased turnover? As previously discussed, experienced nurses are leaving the profession either due to emotional instability, fatigue, retirement, overworking, and inadequate resources, which has increased the strain on the existing workforce. To somewhat resolve a part of the problem, researchers offer the solution of implementing nurse residency programs. Brooke and Atkin has supported this notion in their systemic review of pre-registration programs of early careers. This review resulted that implementing interventions that expose nursing students to the clinical environment have yielded positive outcomes related to transitioning into their qualified practices, which has thus increased the potential for those students' motivation to stay in the profession once they enter. Mohammed in 2024 also proposed that nurse residency programs and other forms of educational intervention improve nurses' retention rates and reduce the impact of the nursing shortages. Other studies show that students of the residency programs had a retention rate of 77.7% in 2016, 90.20% in 2017, and 96% in 2021. These and several other studies showed a significant decline in nurses' turnover rates with nurse residency programs. While existing programs have proved to be beneficial for reducing turnover, they are also very expensive to model and successfully initiate, especially for lower level hospitals, which is part of the reason why many have not implemented them yet. In conclusion, the interplay between organizational culture and structure, leadership styles, and staff can have a direct influence on nurses' intentions to leave and their predicted retentions. Acting on the traits of organizational culture by implementing communication tools and mental health services to help build nurses' self-efficacy and job satisfaction can improve performance and patient outcomes. Within the organizational culture, leadership styles in the healthcare environment can also play an essential role in nurses' commitments to their jobs. While transformational leaders who support and provide positive feedback to their staff play an important role in their willingness to stay, there are limits to quote-unquote transforming nurses when it also comes with increasing overtime, stress, and fatigue. It would also be beneficial to combine the transformational leadership style with trauma-informed leadership because it would not only push nurses to adapt to innovative structures and techniques, but it would also foster better communication between lower and higher level nurses that would often lead to higher work satisfaction and retention. Because nurse managers and leaders who adhere to their staff's needs and complaints are more likely to decrease or prevent increased turnover, it could also positively affect hospital budgets and job satisfaction because it would contribute to the cost effectiveness of training and recruitment in hospitals. In addition, programs such as nurse residency programs can help graduating students to transition into healthcare professions. They provide them opportunities to gain practical experience and skills that provide new nurses aid in navigating complex hospital environments. These programs have been proven effective in reducing turnover rates among new nurses, which help them to prepare them to handle the stressful and dynamic challenges of hospital settings. By equipping them with the mental and physical stamina to endure these hardships and stressful environments, these programs aim to improve nurses' odds of not only survival, but also success and growth in the hospital environment. The following data supports the link between job satisfaction and organizational culture. Within a survey by Hakova and Kilikova of 136 nurses, psychological burdens contributed to 28% of terminations. In another survey of 527 nurses, 63.2% of those nurses, more than half, stated that their working conditions and communication with teams or superiors significantly affected their job satisfaction or dissatisfaction. A separate survey in Poland in 2023 found that burnout affected 13.27% of nurses in the labor force, which also ultimately increased medical errors and patient safety. Based on the findings of this cross-sectional study, it is advisable for hospitals to adopt a range of nurse residency programs that are tailored to prepare new graduate nurses for the unpredictable environments that they might encounter post-graduation. It is also recommended that implementing training programs and policies for mentors and nurse managers on the key traits of transformational leadership and trauma-informed leadership. These could significantly enhance workplace communication and productivity. Not only will they promote effective communication, but nurse managers will also be able to foster a culture of mutual respect between senior and newly hired nurses, which would help to reduce turnover and enhance retention.